Ladies and gentlemen, let's quarantine our attention to the upcoming video. Sit back, relax, and enjoy.
Quarterfinals, you will be given 10 short answer questions. The 30 teams from MCQ round will be divided into 3 divisions. The game will start off with one random keyword, for example, bacterial infection. Then, the competitors will rate their level of confidence in the subject from level 1 to level 3. Level 1, 100 points will be given for a correct answer. Level 2, 150 points will be given for a correct answer. However, an incorrect answer will result in a 50-point deduction. Level 3, 200 points will be given for a correct answer. However, an incorrect answer will result in a 100-point deduction. Each team will have special items, and each of these items can be used once. Double score item. Competitors will gain double the points for the correct answer. Insurance item. Competitors can submit 2 potential answers. Shield item. Competitors can use this for confidence level 2 and level 3. This item protects from penalty point deduction if the question was answered incorrectly. Bonus point. If you answer swiftly and correctly, you will receive bonus points according to the criteria on the screen. If you use double score item, this bonus point will be added after the item was used. After 10 questions, the top 2 teams with the highest scores in each division will enter the semi-finals. The teams in the rank 3rd, 4th, and 5th will pass to the resurrection. In the case of a tie, the competitors will enter the sudden death round. Sudden death round. Competitors will receive one short answer question. This round will be based on speed, and competitors who submit an answer and presses the buzzer button first will have their answer checked first. The first team with their answer marked as correct will progress to the next round.
That's it for the rules of the quarterfinals. If you have any questions, please feel free to ask before we continue. Please raise your hand to indicate that you have a question.
We have someone who is asking. Our colleagues will get to you real soon. All right, and in the meanwhile, let's welcome our first division on stage.
Yes, teams in the first division, please come up to the stage. Please welcome, first of all, the team 3 of a Kind.
Next, we have Air.
Coming up third, Bravijaya's Warriors.
And next, we have C4B to A3B.
followed by Sharinoponga Kanuniai.
Next, please welcome the Marvelous Three.
Coming up after 3, we have Siriratu.
And next, we have T2 and 0M1.
Then viral vectors.
And last but not least, we have Yap Yap.
Now that everyone is in their positions, the quarterfinals shall commence. May all teams be immune to defeat. Coming up first, our first keyword is bacterial disease. Now, you have 15 seconds to choose your level of confidence and choose an item to use if you wish to do so. The time is now up. We'll be kicking things off with our first question. Our first question is, give full scientific name of 2 causative agents of rat bite fever. Your 60 seconds to choose the correct answer begins. Thirty seconds left, teams. And that's a wrap. All right, let's see what our teams have answered. Well, from the looks of it, we seem to have quite a degree of consensus in what our teams have decided to answer, with most answers seeming to have Streptobacillus monoiformis in it. Other answers that are quite popular is Spirillum minus. Though we do seem to have some answers that have left the first letter of S entirely, such as Yersinia pestis. Pat, what do you think about this?
Right, as this is just the first question, I can feel that our contestants are still, shocked with that we have started, but I can tell that most of the team did go in the same way for the answers, seeing that most of them did answer Streptococcus moniliformis. However, there are some teams that vary in their, spellings, and I wonder how do we actually spell the name of this bacteria? And we also have teams that choose to answer differently, so we'll see what the answer is.
Yes, let's see what your choices. Let's see if your choices are correct. All right, let's review the correct answer, which is Streptobacillus monoiformis, or Streptobacillus notomitis, or Spirillum minus. Let's see how this matches with our participants' answers. Wow, from the looks of it, we have 2 teams that got it correct. A major congratulations to these 2 teams. Now let's see how this affects our scoreboards. Coming up in first place, we have the team Sharinoponga Kuniniai. Congratulations to this team. Your decision to choose a high confidence level certainly paid off. In second place, we have the team Bravinjaya's Warriors. Now, congratulations to both these teams for being in the top 2. Perhaps it's soon going to be time for our next keyword.
All right, that was an interesting way to start our first division. Now, on to our next keyword. The keyword is genetics. Your 15 seconds is on the clock. And you're out of time. Now it's time for the question of genetics. A 32-year-old man presents to the clinic with symptoms of fatigue, jaundice, and right upper quadrant abdominal pain. He reports multiple unprotected sexual encounters and a history of intravenous drug use. Blood tests reveal elevated liver enzymes and increased total bilirubin levels. Serological tests show the following results. Which phenomenon best describes the process by which interaction of viral gene products in cells infected with 2 viruses, one or both of which may be defective? You have 1 minute to answer. Begin. "30 seconds remaining. And time is up. Now let's see what you guys have answered. It seems like we have 2 teams here, 2 big teams. One of them being the super infection team, and another of them going for complementation. However, some minority are saying something in specific about saying a co-infection of 2 viruses. So it's pretty interesting how teams interpreted the question pretty differently. But remember, this is just the second question. But I can feel that our contestants are already excited for this stage, and I think we shall see how things will go in the end, because we have a really, really long way to go, and I feel like our audience is also excited to see how teams will answer. All right, and the answers are ready. For this one, it is complementation. Now let's see how our team have done. Congratulations, we have a lot of team who got it right. Coming up is the current scoreboard. Congratulations, we have someone who took the second place. And we still have the undefeated first place on Showinopala Kanuniai. Now, we shall wait for the next keyword.
All right, our next keyword is ready. So without further ado, here comes our next keyword: superficial fungal infection. You have 15 seconds. Your 15 seconds is up. On to our question. Microscopic examination of skin scrapings from the dark brown lesion on the left palm revealed branch septate hyphae and budding yeast cell with melanized cell walls. What is the scientific name of the causative organism. 60 seconds is on the clock. Begin. "30 seconds remaining before our infection gets to you." Time's up. The infection has made its way to you. Let's see what our participants' answers, or shall I say dying breaths, are. It looks like one team has decided to use their insurance and has given out 2 answers. Regardless, there is a pretty clear consensus on what the answer is, with most teams answering Hortia werneckii. The second most popular answer choice is Mangasia furfur, though we have 2 variations of spelling of Mangasia, so we shall see which spelling is correct. I think that it is certainly thrilling to see quite a few hidden variations in our participants' answers after all.
Right, and my most favorite part is that teams are starting to use their items now.
I agree, it is certainly very interesting. But without further ado, let's see what the correct answer is. The correct answer is Hortia werneckii, or Exophaga werneckii. Let's compare this to what our participants have sent in. Wow, quite a lot of teams have gotten this correct. Only 7 out of our 10 teams have gotten it correct. So let's see how this affects our scoreboard. It seems Team Shawinoponga Kununiai has maintained first place for 3 rounds in a row. Congratulations! Though we have a new second place, which is Sirera Team 2, who has chosen the same confidence level as our first place team, but only took 9 seconds. That is certainly an extremely impressive feat. Congratulations to Sirera Team 2, our new contender. We will see in the next round how our scoreboard changes, because it's changing quite a lot. So without further ado.
And here is our next keyword. Parasitemia. 15 seconds. Make your decision. And the clock has run out. Now, for parasitemia, the question is, a 54-year-old man presents with daily fever and shaking chills for 5 days. He recently camped in a forested area where the cottage was surrounded by wooded terrain populated by macaque monkeys. Initially, he was diagnosed with Plasmodium malariae based on a blood smear. Despite treatment, the patient does not recover and develop complications. A subsequent PCR assay reveals a different malarial species. What is the most likely causative agent? Give a full scientific name. 60 seconds is on the clock. Begin. Make it count. Everyone, you have 30 seconds left. And time is up. Now, coming up are your submissions. Wow. For this one, I can say that we have a real consensus here on going for the species of Nolici of Plasmodium. And now that we're almost halfway through, I can feel that the pressure is not just on our contestants, but the audience are really engaged in answering these questions as well. We can see them cheering on the teams. We can see how they react when they say the topics. And in this case, the answer is Plasmodium nolici indeed. Congratulations, team. Now let's see how you guys have done. As expected, most of them got it right. Also, teams, at this section, if you wish to appeal our answers, you can do so by raising your hands. All right, coming up is the current placings. Although the placing remains unchanged, but we can see how we have a really close call from the teams following under. So I feel like it's anyone's game in the end. So we should wait and see how things will unfold.
Agree. There is actually a tie between the third and fourth place team, I believe, with an exact score of 305. So that is certainly very exciting, and we can see, and we cannot wait to see how things are going to turn out in the subsequent rounds.
All right, as we're just halfway through, let's take a little break and have our contestants leave their stress away from their brain, because this is just the first division. We don't want that much pressure on you guys.
Yes, so now that we've all taken a very nice breather, I would like to continue our competition. We're officially halfway to and are now on to our fifth keyword, which is molecular immunology. 15 seconds start. Choose wisely, but quickly. The clock has run out. Please quarantine your attention to our question now. Our question is, a 45-year-old female presented with complaints of multiple skin lesions and numbness in her hands and feet for the past few years. On examination, she had hypopigmented and erythematous skin lesions with loss of sensation on touch. Some of the lesions appeared nodular and infiltrative. Skin smear examinations showed findings as depicted in the pictures. A skin biopsy confirmed the presence of 2 granulomas with foamy macrophages containing bacilli. Name 2 cytokines that are predominantly expressed in this condition. You have 30 seconds to solve it, and your time starts now. 60 seconds.
Teams, you may press on the picture to zoom in for more details.
Half a minute left, everyone. Show your brilliance. Use your items. Just kidding. And you've hit curfew. Your time is up. Let's see what our participants have sent in. Wow, from the looks of it, our answers seem to be in the range of variations of interleukins. We have everything ranging from interleukin 2 to interleukin 4 and 5, all the way to interleukin 12. Some teams have also sent in TNF alpha and IFN gamma. This is certainly a very wide range of answers, but let's see what is actually correct. The correct answer is interleukin 4, interleukin 5, and interleukin 10, or any combination of them. So let's see how this compares to what our participants have sent in. Wow. Congratulations to Team Air for being the only team that got this correct. This is certainly a very difficult question, but we now have a new contender. So let's see how this changes our scoreboard. Wow. Team Air has rose all the way to third place, and now they are a contender for the top two, trailing only 10 points behind Sirirat Team 2, who is currently in second place. So Team Air could be taking second place next. Sirirat, they are hot on your tails. But Chawino Ponga Konuniai has maintained a healthy lead and has kept their first place position regardless. So we shall see how this unveils in our subsequent rounds. I'm certainly very excited, and I'm sure our audience and competitors are as well.
All right, now let's see the keyword for the next question. Bacterial infection. You have 15 seconds. Make your move. And the clock has called. Now it's time to see the question. A 60-year-old man with HIV positive and bronchiectasis has fever, weight loss, and cough for more than 3 weeks. The results of Zeal-Nielsen staining and bacterial culture from clinical specimen are shown in the figure A and B respectively. Bacterial colonies appear within 2 to 3 weeks. The patient was treated with combined drug, including rifampicin and ethambutol. However, he did not improve after 2 months. What is the causative agent of this infection? Please give a full scientific name. You have 1 minute to answer. Start.
A reminder that you can zoom in to clearly see our figures.
"15 seconds remaining. And time is over. Now let's review your answers. We actually have a few consensus with also some of them going for different. So we'll see if the majority is right for this one, or is it the minority. So for the majority, we can see that they're going for the genus of Mycobacterium, but we have a difference in the specific epithet for this one. So I wonder which one is actually correct, or are they all correct? What do you think, Pat?
I agree with Pat. There is quite a lot of variation, going all the way to, say, Mycobacterium avium, and then changing between complex and intracellular. So we will have to see whether or not our judges and correct answer will say accept both of these, or if our correct answer is so minute that only one of them could potentially be correct. I think that this is certainly a very interesting round where there's quite a lot of detail, which means that perhaps not that many teams could get this correct, or maybe multiple teams will get it correct. It's certainly very thrilling, very eye-catching, and very interesting.
Right, and the fact that we have a really close placing in each team, so it really does matter how teams did for these questions, as we're almost to the last question and we have really few questions left. So it can be anyone's game and things can change at any moment.
I agree. We only have 3 more questions left, and we can see our audience is currently very fully focused on the screen and the competition. So without further ado, Pat.
All right, and the answer we're looking for is Mycobacterium avium or Mycobacterium intracellularare. Now let's see how you guys have done. Unfortunately, none of you guys got it right. However, if you wish to appeal, you can do so by raising your hands now. All right, so I think we're settled. Now, coming up is the latest scoreboard. Oh, it seems like we have someone who's appealing. So please raise your hand and our colleagues will get to you soon.
Excuse me, judges. We were wondering, could our team be considered correct since we got both the species right? Yes, Mycobacterium avium and intracellular.
All right, Team Air, you are quite excellent on this question. I really commend you on appealing to this. However, we are asking for full scientific names, and I quote from our textbooks. Member of the Mycobacterium avium complex, or MAX. Although some species do not cause human disease, representatives of the 2 most common MAX species, M. aviums and M. intracellularis, are human pathogens. So this is from our standard textbooks. So you must answer Mycobacterium aviums and Mycobacterium or Mycobacterium intracellularis. All right, good luck.
We wanted to, we wanted to do that, but seeing the time, we didn't have enough time, so we just wrote it like that.
You can just answer the Mycobacterium avium should be okay. Either one of them should be okay.
Okay.
Sorry.
Thank you.
Good luck.
All right, thank you team for appealing and thank you our dear professors for the clarification. Now let's see the scoreboard. Although none of them got it right, but there are changes of the scoreboard. We can see that being too confident and choosing high confidence level can actually get you a penalty of point deduction. So be careful, teams.
Regardless, this question hasn't changed the scoreboard. Now, I know a lot of you may be discouraged by the fact that everybody got it incorrect, but that's just question number 6. We still have 3 more questions left. So let's get to our next keyword. The keyword this time is viral infection. You have 15 seconds to make some decisions. Decision-making time is now up. It's now question time. On to our question. A 1-year-old child presented to the Department of Pediatric Dentistry with oral ulcerations. The toddler was having trouble eating and drinking. according to his parents. Oral clinical examination found several round vesicular ulcerated lesions on the soft palate and one large lesion in the deeper part. There was no other cutaneous or mucosal involvement. What is the diagnosis? Your 60 seconds begins now. Best of luck. "30 seconds. Make it count." And your time is up. Let's see what you guys have sent in. From the looks of it, we almost have a consensus with 8 out of 10 teams answering herpangina. Actually, quite a lot of teams seem to have taken very few seconds to answer this. Multiple teams only took 5 seconds, but certain teams did go up to 55 seconds. So it'll be interesting to see the effect of time or how quickly you answered actually has on our scoreboard. So I think this is certainly very interesting. So without further ado, let's see what our correct answer is. It is indeed herpangina, so congratulations. Let's see how this matches with our participants' answers. 8 out of 10 teams got this correct, so congratulations to those 8. Now let's see how this affects our scoreboard. Oh wow, we have a new first place. Major congratulations to T2 and 0 M1 for overtaking Shawenoponga Kanuniai. Wow, your decision to use a high confidence level certainly paid off. So congratulations for that very strategic and smart decision. But Team Shawenoponga Kanuniai is only trailing behind by 25 points, so they can still catch up. Same with Air and Siraratu, you guys could regain your lead. So once again, a huge congratulations for our new contender. And on to our next keyword.
We have only a few questions left, team, so here comes the next keyword. Diagnosis. You have 15 seconds. And time is up. Now, let's go to see the question. A 6-year-old boy with chronic granulomatous disease presented with chronic pulmonary infiltrates and lung tissue biopsy was revealed in the figure. Which fungal antigen is most detected in serum samples using enzyme immunoassay for the diagnosis of this disease? You have 1 minute to answer. The challenge begins. "30 seconds remaining. Think fast." That's a wrap. Now, let's see what our participants have answered. We have actually a pretty broad range of answers, although there are some teams who have answered a pretty similar answer, which was galactomannan, some of them going for aspergillus antigen, some of them are saying glucans. We have also teams who have said PAMs, so I wonder which one is correct. Now, the valid answer we're looking for is galactomannan or GM. So, let's see who got it right. Congratulations, teams. All right, now we shall see the scoreboard to see how the teams are doing. We have a really close call. The game is really anyone. We have Siriraj too, who took the second place, and we have T2 and 0M1, who is still on the first place. I can tell that it was a really, really smart move from them for using a high confidence level and also using all of their items already. That is a really strategic move from T2 and 0M1.
Yes, regardless, we do still have 2 more questions left. So could it be a bad decision in the long term for Team T2, 0M1 actually? Because the current second place and third place team both still have their shields left. Regardless, there is barely really any score points difference between Team 1 to 3. So it could be anyone's game, really. So we are certainly excited to see how our first division of the quarterfinals is going to essentially wind down and run its course. Now, our second to last keyword is... Our keyword is... intestinal obstruction. Your 15 seconds begins. The time has run out. All right, the question you'll be getting next is, a 45-year-old vegetarian with a history of Laffer's pneumonia over the past 2 months presents to the emergency department with acute abdominal pain, fever, vomiting, cramping, and an inability to pass stools or gas. The ultrasonography reveals an intestinal obstruction at the terminal ileum caused by a mass of worms. What is the intermediate host of the causative worms? Your 60 seconds begins. "30 seconds left. Time's a wasting. And our time is all gone. Let's see your answers. Wow, this is certainly very interesting. Perhaps the easiest to pronounce answers we've ever gotten thus far. Our answers range all the way from there's no intermediate host to soy, to pig, to cockroach, to fish, to human. We've basically covered everything from nothing to water to land, all the way to ourselves. So without further ado, let's see which one is correct. Please don't tell me the answers in the sky. Let's go. The correct answer is there is no intermediate host, or no. Wow, this is certainly very thrilling. I do believe some teams actually answered this. So without further ado, let's unveil who those teams are. Congratulations to 3 of a kind, T2N0M1 and Sharanopala Kanuniai. I do believe that this means we might be having a change in who our top 2 is. So let's see. Back in second place is Sharanopala Kanuniai. So congratulations to this team. And team T2N0M1 has still maintained their healthy first place lead. So there is starting to be quite a bit of a difference in the overall points for our top 2 and our third place team. But I do believe there is still a degree of hope for Seranga Team 2. And Team 4 and 5 are also relatively solid in their standing in the top 5. Though we have an appeal, so our colleagues will get to you very quickly.
Okay. Appeal.
Excuse me, judges. For this question, we answered pick because since we thought there has to be an intermediate host, and since other than Ascaris lumbricoides, there's also Ascaris suis that has the same symptoms and has an intermediate host, which is a pig. Could you please consider our answer? Thank you in advance.
So, as this case occurs in the human, and the causative agent of this case is Ascaris lumbricoides. So there is, it has the simple life cycles. So there is no intermediate host, or it can say no intermediate host. Yes. Yes, Ascaris is it has the pig as the definitive host. But in this question, we are concerned about the human infection. So the human is the definitive host of this worm. Okay? Is it clear?
Thank you for the explanation.
All right, thank you for the appeal and thank you our professors for the clarification. All right, hopefully we have not caused any trust issue for that question.
Yes, I agree. Hopefully people will still continue to retest questions and not always be fooled into thinking, what if they're tricking us?
All right, ladies and gentlemen, we have made it to our final keyword. If you've been gatekeeping your items, please make sure to all in, because it's time. The final keyword is mutation. You have 15 seconds. And your time is over. Guys, make sure you give it all for this one. On to the very last question. A 1-year-old boy presents with eczema and red patches on the skin with a history of recurrent streptococcal infections. Blood analysis show leukocytopenia, lymphopenia, and thrombocytopenia. Total serum gamma globulin levels are in the reference range. The IgM, IgA, IgG levels are lower than normal. The analysis of which gene can be used to confirm the diagnosis. Your last 1 minute begin. 30 seconds left. And your last 1 minute is over. Now let's review the answers for this one. It seems like we do have a pretty, we still have two teams for the last question. We have teams who have go for an abbreviation of a gene, I suppose, which is WASP. And there are also teams who said Wiskott-Aldrich. Some of them are going for BTK, which is Bruton tyrosine kinase. And teams, the moment you've been waiting for. The answer for this question is Wiskott-Aldrich syndrome protein gene, or WAFS gene. Now let's see who got it right. Congratulations, we have two teams who got it right. Now, everyone, the moment we have been waiting for. Onto our final scoreboard.
Well, it is official now. This is our final scoreboard for the first division of the quarterfinals. Congratulations to Team T2N0M1 and Team Shawinoponga Kanuniai. Both teams will advance straight to the semifinals, and our adorable three Powerpuff Girls there cannot wait to greet you. Now, for the teams that placed 3rd to 5th, namely Siriratu, Air, and 3 of a Kind, there is a silver lining because you get to compete again in our resurrection round for another chance to join T20M1 and Chawinoponga Kanuniai in the semifinals. So this is now the end of the first division of the quarterfinals. Thank you all for playing, and you may now exit the stage. Congratulations once again. There is an adorable mini pop quiz game for you to play where you could win a adorable purple elephant plushie if anyone wants to stick around during our break. And we'll be back to you at 9:35 a.m.
All right, teams, if you wish to take a break, you can do so. Take a little breather, relax, and simply chill out. But who is still with me? We have a mini game called Pop Quiz. So the rules are simple. Just take out your phone and we'll show you the QR code up the screen. These are the QR codes that you can answer a mini question. And those who got it right will receive a little small elephant cute plushie, special for CMU-IMC. All right, teams, you have 3 minutes to answer. The fastest will win. All right, teams, you have 30 seconds left for this pop quiz. All right, time is up now. Now, let's see the answers for our pop quiz. For answer number 1, it's choice B, heat labile metalloprotease toxin. Did anyone got it right? Congratulations, I hope you're the lucky one who got your prize. Now, the answer for question 2 is choice E, penicilliosis. Who got it right? Congratulations, I do wish you the best to get our small cute elephant plushie. All right, so these are the people who got our prizes. And for question 2, congratulations, our lucky competitors. You guys will be contacted by our GM to claim your prize. All right, now let's take a little break as we wait for the second division to start.
Return to your seats. We are starting the second division of our quarterfinals now. All right, so teams in the second division, please come up to the stage. Please welcome Universitas Lambung Mangkurat Team 1.
Next, we have Saibala.
Coming up third, we have SSS Aga.
And next, we have Defender Against Neglected Infectious Diseases, Universitas Indonesia.
Then we have CU.
And we have Ovaltine Weimalt.
And following Ovaltine, we have Siringat 1.
Next, we have Universitas Lambung Mangkurat Team 2.
And the three little piglets.
And finally, we have Beta Squad. All right, before we begin, allow me to briefly go over the rules again. Before every question, you will hear the keyword. You have 15 seconds to choose your items and level of confidence. You will hear the question next. You have 1 minute to answer. Do your best.
All right. Let's wait for everybody to get to their positions. From the looks of it, now that everyone is in their positions, the quarterfinals shall commence. May all teams be immune to defeat. Let's get started. Our first keyword is wound infection. Now, you have 15 seconds to choose your level of confidence and choose an item if you wish to do so. The time is now up. We'll be kicking things off with our first question in this division. The question is, a 65-year-old man had burn wounds last week. He has high fever and blood culture positive. Gram stain, subculture on blood agar, and antibiotic susceptibility tests are shown in the figure below. What is the most important screen toxin that inhibits protein synthesis? 60 seconds is on the clock. You have 1 minute to choose the correct answer. Best of luck. Don't forget, you can zoom in to clearly see our cultures. "30 seconds left. And that's a wrap. That's it for our first question. Now let's see what you guys have submitted. Wow, there is nearly a complete consensus with most teams answering exotoxin A. And there's even one team that decided to be a bit different and answer endotoxin. So there's a bit of a question. Is it exo or endo? In or out? All right, now let's see our correct answer. Perhaps it's something that starts with a P. The correct answer is exotoxin A, or ETA. Congratulations. Let's see how this matches with our participants' answers. Wow. Well, congratulations to 6 teams who answered exotoxin A. Let's see our first scoreboard reveal. In first place, we have ULM Team 1 and ULM Team 2. So ULM is certainly really taking it home today. And they both answered very quickly, but Team 1 shows a higher confidence level. So this really shows how picking up certainly really pays off. In third place, we have Sirirat once again, just like their predecessor. Just kidding. Congratulations to Sirirat Team 1 for being in third. And we have Team Dengui and SSS Agar also in the top 5. So this is certainly an exciting start. Now,
That's right. I can feel that it's a really interesting start indeed. Now, let's go on to our second keyword. This keyword is rabies. You have 15 seconds. And you're out of time. Now, on to the question about rabies. Name a muscular form of the receptor for rabies virus. You have 1 minute, start. Thirty seconds remaining. And that's a wrap. Now let's see what you guys have sent in. We have a pretty consensus here saying nicotinic acetylcholine receptor. We also have some of them who chose to answer in a abbreviated form, so I wonder if that is accepted or not. Although there is Ovaltine White Mold saying rabies, being the receptor for RASB itself. So that's a pretty interesting way to answer.
I do agree indeed that we do have quite the consensus today, though there are some teams that decide to use the abbreviation and one that isn't using nicotinic. So we'll be seeing how that plays out.
Right, and the answer is ready. The answer is nicotinic acetylcholine receptors. Congratulations. I believe most of them got it right. Now let's see. As expected, most of them got it right. Now, coming up is the scoreboard. We have a new second place. Congratulations to Sirirat 1 for making it on top. Actually, we have a really close call for our second division. We can see the score are real close with just a few tens score range difference.
Yes, I agree. I saw that Team Denki and Sirangat were actually only 5 points apart. So we could have a new second place and third place, switching it around. All right, so now here comes our next keyword. Morphology. 15 seconds starts now. Let's hope you pick the most beneficial confidence level. Your 15 seconds is up. On to our question. A tissue biopsy specimen was taken from a cauliflower like Eratumus papaw The culture of the specimen grew a darkly pigmented mold identified based on characteristic conidation as Phylloxera verrucosa. What is the diagnostic morphology in tissue for this mycosis? 60 seconds is on the clock. Begin. Right teams, 30 seconds remaining. Make it count. And you've hit curfew. Your time is up. Let's see what you guys have sent in. Well, the first thing I notice is the use of an insurance. Regardless, we do have sort of a consensus with, I believe, almost half of the teams answering Metnar bodies. Other common answers seem to be sclerotic body. So it appears that the correct answer is likely a variation of something body. Though regardless, I think that this is a relatively difficult question. What do you think, Pat?
What I'm looking at is that I'm interested in how teams actually used seconds of time to answer for this one. We can see some teams using just 6 seconds, 7, some are going in the lower than 30 seconds. So it brings up to the question, is this one too easy for Division 2? What do you think, Pa?
I do agree. I previously thought that this was pretty difficult with the interesting range of answers, but perhaps you're right. But without further ado, let's see who got it right. The correct answer is sclerotic bodies or Metna bodies. So maybe this is why we had two different answers, because both are correct. Now, let's see how this compares to what our participants sent in. Wow, congratulations to 9 out of 10 teams for getting it correct. Let's see how this affects our scoreboard. Currently, in first place, we have our undefeated champion, ULM Team 2. So congratulations. They also answered extremely quickly with only using 9 seconds out of the available 1 minute. That is amazing. And they've gained a 90-point lead on our second place team, Sirirat 1. So congratulations. Though it seems first place has already used their insurance, but our second place team hasn't. So it's certainly interesting. This could be anyone's game, and we are just getting started.
All right, and without further ado, here is our next keyword. Raw fish. You have 15 seconds. And the clock has run out. It's time for the question about raw fish. A 54-year-old man who regularly consumes undercooked freshwater fish has had intermittent migratory swellings on upper eyelid of his left eye with hyperuremic conjunctiva. This organism shown in the picture below is surgically removed from the lesion. What is the first intermediate host of this parasite? Teams, you have 1 minute. Begin. Everyone, 30 seconds left. And time is up. Now, coming up are your submissions. I do see some of them going for a consensus, and some we have like little teams, small teams for this one. We have Kopi Pot team, we have Snail team. We also have someone going for snake, fish, and dog and cat. But what interesting here is that I see most of them using items for this one. And I also see one team using double score. So is it that they're confident about raw fish? Actually, there were the only one team who used double score while others were using shield. So let's see if they got it right. The answer is Kopi Pots or Cyclops. Now let's see who got it right. Congratulations to team who got it right. Let's see how this will affect our scoreboard. The scoreboard should be coming real soon. Wow, this is a big change for this question. We have teams who have moved up and down pretty new look of our scoreboard for the Division 2. So we can see that what I'm interested here is that Team CU actually used their double score and got awarded for their confidence. And they even chose their confidence score of 3. That is a really bold yet the best move I've seen for this division.
Certainly, it has been a very exciting round, seeing as to how a strategic item use and confidence level usage by Team CU has brought them up to second place. Regardless, 0 at 1 is number 1. You know I love my puns. Now, we are officially halfway through and on to our 5th keyword, which is immunodeficiency. 15 seconds starts. Choose wisely, but quickly. The clock has run out. All right, everyone, please quarantine your attention to our question, which is: a 7-year-old boy visited hospital with a history of recurrent respiratory tract infection since the age of 3. He developed exacerbation of symptoms, orotracheal intubation, and invasive mechanically ventilation was administered. The result of his blood test is as follows. A genetic testing revealed a hemizygous mutation in a gene known for its involvement in a pre-B cell receptor signal transduction. The mutation subsequently resulted in the failure of B cell maturation beyond the pre-B cell stage. What is the full name of this disorder? Wow, that is a long question. Your 60 seconds to solve what is wrong with this boy starts now. Friendly reminder, you can zoom in if you can't see any of the values in our figure. "25 seconds remaining. And time is up. Let's see what our teams have sent in. Wow. This is certainly one of the longest answers ever. Well, from the looks of it, there is a lot of Bhutan's or X-linked hemoglobin So we shall see if this is correct. We also have severe combined immunodeficiency. So it's quite a lot of immune deficiency or something X-linked, something about Bruton. So it's very clear that most teams have agreed that this is likely some sort of genetic or immune system related issue. So I guess we shall see what the correct answer is going to be from all of this very controversial and very different set of answers. Without further ado, our correct answer is Bruton's or X-linked agammaglobulinemia. So congratulations to the teams that got it correct. Those teams are, wow, we have 5 teams that got it correct and 5 teams that got it wrong. So it's a nice split right here. So let's go see how this affects our scoreboard. Currently, still in first place, Sirirat number 1. We love it when one is indeed number 1. And CU is in second place. From the looks of it, this time the CU team decided to not use their tricks and picked a lower confidence level. All right. It does seem that both of our teams did use about 40-something seconds before getting their answers submitted, so this might have been a relatively difficult question.
All right, and we have passed question 5. On to question 6. Let's see the keyword for this question. Diagnostic test, 15 seconds on the clock. And the clock has called. It's question time. Name 2 serological tests most used for measuring reagenic antibodies that developed against lipids released from the damaged cells during the early stage of disease associated with lesions and causative organisms shown in the pictures below. You have 1 minute to answer. Start. Twenty seconds remaining. And time is over. Now let's review your answers. I can tell that we have a real consensus here. Most of the teams are saying the same thing. I can see that they're going for VDRL and RPR. So I wonder if these are really the most used serological test. Actually, we can see that some teams also are going for the insurance item, but answered only 1. So I wonder if they were confident after using their items. I can feel that they are unsure that they are correct. So we'll see how things unfold for them.
Yeah, I agree. This is certainly an interesting round with most teams answering RPR and VDRL. So perhaps these are indeed the most commonly used serological tests. Though some teams did decide to go with answering something a bit different, such as ELISA or dark field microscopy or FTA ABS. So we will have to see if it pays to be different this time, where you could perhaps be the only person gaining a point, which could shoot you all the way up to the top 2, or if our majority teams will be getting the points and perhaps our scoreboard will still look similar.
Right, and we've been halfway through already, and I can feel that our contestants are having their pressure on. So, teams, breathe in and out, okay? And the audience, I can feel that you really want to give them some big round of applause for taking their time here up the stage. Let's give them a big round of applause during we take this break.
I do agree that some words of encouragement are needed. This is one of the more, how do I say, process, one of the more thrilling rounds where actually our top two has remained quite consistent, but their points are not that far off. So it is really anyone's game. And we do still have 4 more questions left in this division. So that is certainly very interesting.
All right, everyone. So we have to apologize. We're currently experiencing some technical difficulties. So at this time, you could take some break and talk with your friends so you can enjoy and ease out the situation a bit, because I can feel like the pressure is really on both our contestants and audience.
Teams can choose whether they want to use this time to relax, slow down their heart rate a bit so they can think very clearly in the next question, or if this is a good time to perhaps strategize as to which item they should be using next, which confidence level they should be using next, so that they can pull up some impressive feats, such as jumping up 3 positions on our scoreboard. This is a time that can be used very wisely and could potentially change the outcome of this quarterfinal round.
Right, and we've been through so many topics actually for both in Division 1 and we're halfway through in Division 2. And if I'm not wrong, I've never seen the same topics from both division yet. So I can tell that talking about the infectious disease theme, it covers a really broad range of compartments, whether it be parasitology, microbiology, immunology, and even pathology. So these are really a huge compartment that all the teams need to memorize. All right, so teams, we're back, and now let's see the answer for this question. The answer is VDRL and RPR indeed. Also, teams, for this question, there will be no bonus points for any of you. We have to apologize. All right, now let's see how your answers are correct or wrong. Congratulations, we have a pretty much consensus and all of them got it right. So let's see how this affects the current scoreboard. Although the placing remain unchanged, right, Pa? I can see that we have a really interesting coming from ULM02, which is a really close call from CU because there are just a few scores behind and it can really be their place in the second place, I can feel.
Yes, indeed, I agree. There's actually only a 25-point difference between our second and third place, though our first place team has taken the leads by over 100 points. Regardless, as the CU team has demonstrated a very high confidence level and a very good use of items, namely the double score, could actually easily overtake that 100-point lead. So if I were sitting at Team 1, I'd be keeping an eye on all my competitors because they still have a chance. And we do, I believe, have 3 more questions left in this very thrilling division of the quarterfinals. Regardless, let's get in on it. The keyword this time is serological profile. You have 15 seconds to make some decisions. Decision-making time is up. It's now question time. Our question is, a 40-year-old man presented with clinical symptoms inconsistent with hepatitis. He has no history of hepatitis vaccination. His serological tests for viral hepatitis are shown below. Based on these results, which hepatitis virus is the most likely cause of his disease? You have 60 seconds. We're counting down from 1 minute. Let's go. "30 seconds remaining before the infection gets to you." All right. Time is up. The infection has made its way to you. Now let's see what our participants submitted right before they got infected. Wow, there's a lot of hepatitis. Well, obviously, because we asked for a variation of hepatitis. From the looks of it, hepatitis C is the most common answer, with one team answering hepatitis A, but it is the CU team, and they did use their insurance, so they'll get the point regardless of whether or not A or C is correct. And then one team wrote HEV. So we will see if it pays to be different this particular time. Hut, what do you think?
Right, I can tell that we pretty much have a consensus again in Division 2. We've been through so many consensus of answer, I think. And I do wish the best for all of you that hepatitis C is the correct answer.
Yes, I would also like to note something very interesting, but Sirangat 1 and ULM Team 2 both actually took less than 10 seconds to answer this question, whereas some other teams went up to all the way to 27 seconds, all the way to 30, 40 something seconds. So we will actually get to see the effect of time or how quickly you submitted your answers on how many points a team could gain this particular round. So it's very exciting to see. All right, without further ado, let's unveil our correct answer, which is hepatitis C virus or HCV. Let's see how this aligns with what our participants sent in. Well, congratulations to 7 of our teams for getting it correctly. Regardless, there is quite a variation in time. So let's see how it plays out in our scoreboard. Wow, maintaining their lead is Sierra Team 1, who answered a lot faster than the CU team. So they've maintained quite a healthy first place. And second place follows behind third with only 5 points, which means that it's really anyone's game for second.
All right, it seems like we have someone who's appealing, so we'll see.
Hello. Good morning. We believe the question asked for the type of virus, which hepatitis virus, not the pathogens. So surely the by context referring to hepatitis virus already.
So in this question, asking about the name of the pathogen and with the name of the virus, the word virus is including in the name, is not it cannot abbreviate, and we also have that in the rule book that you should add the virus word in the Hep C virus.
Thank you very much.
Regardless, that was a great attempt from our Three Little Pigs team.
And thank you, our professors, for the clarification. All right, only a few questions left, everyone. Here comes the next keyword. Mycological infection. 15 seconds. And time is up. Now let's go to the question. A 48-year-old woman was admitted to the hospital for evaluation of progressive dermatosis involving the right nostril, cheek, lip, despite antibiotic therapy. She was positive for HIV. CD4 lymphocyte count was equal to 21 cells per cubic millimeters and had lived in Miami, Florida for the past 18 years. Histopathologic evaluation of a skin biopsy was shown in the picture. What is the causative agent? Give a full scientific name. You have 1 minute. The challenge begins.
"30 seconds remaining.
And that's a wrap. Here are your submissions. We have a pretty commonality of answer here, so we can see that most of the team have answered Histoplasma capsulatum, but we have one team who have specified into the subspecies. So I wonder if they are correct for this one. And actually, I've seen so many teams who are using items, and I'm glad we're seeing that because I can feel that in this round, the items are really the game changer for this one. So let's see how these items are doing for them. How would you think about this question?
Well, I think that this is certainly one of those questions where everybody seems to know what to answer because everybody seems to answer it pretty quickly with even the teams that took the longest, with an exception to the teams that used their insurance. They only took up to 30 seconds. So I think that it is one of those questions that people moved pretty quickly in. The answer must have just popped right into your heads. They really said, I'm going to show my brilliance today. So that is certainly really amazing. Though I do see that some teams did decide to answer something a bit different than what is the common answer, such as our Three Little Pigs team, who wrote something such as paracosio, for instance. So it will be interesting to see how that plays out in the scoreboard. Perhaps it is the correct answer. Who knows?
Right, and as you mentioned, besides from the items being the main game changer for this round, the time that they used for each question is actually another big game changer because these tiny bits of score can actually change the game.
I agree. And actually, we can see our first place team this time took 30 seconds, whereas our previous second place team, CU, took 10 seconds. So this could mean we could be having a switch as to who our top two is going to be. Or perhaps our third place will finally overtake our second place team because in the last round, they were only trailing behind by 5 points. So maybe we'll be having a shift in the top 3 entirely. We'll just have to wait to see.
And as we have a really close call in our second division, so let's see if their answer is correct for this one. The answer is Histoplasma capsulatum indeed. All right, so it seems like we have an appeal, so our colleagues will get to you.
Hello. Based on this case, the patient have lived in the Miami, Florida. So it means that the specific answer should be Histoplasma capsulatum subspecies capsulatum, since he or she did not come from outside of United States. So we have to specify the subspecies itself. If we answer this case with Histoplasma capsulatum only, I think it's too broad. Please consider this kind of case.
Thank you for your challenge. Asked about the causative agent as a broad origin with the histo. So thank you very much for your answering about the subspecies, but the causative agent full name that didn't go into subspecies are also accepted.
All right, thank you teams for appealing, and thank you our professors for the clear clarification. Now let's see how teams have done. Congratulations, most of them did get it right. All right, now let's look at the current scoreboard. Although the placing remained unchanged, I can see that we have a really close call with just 5-point difference from the second and third place. So I can feel that the pressure is building on both of them.
I agree. We really have essentially a tiny sort of like mini competition going on between second and third as to who will have to go to the resurrection round and who can proceed directly to the semifinals. But without further ado, let's have this competition continue with our 9th keyword, which is worm. 15 seconds is on the clock. The time has run out. The question you'll be getting next is, a 28-year-old woman presents with a history of weakness, headache, anorexia, abdominal pain, and diarrhea. Stool examination reveals an unknown organism as shown in this image. And you can zoom in on this. What is the scientific name of the causative agent? Give a full scientific name. Full this time. All right. Countdown begins. 60 seconds. "30 seconds left. Times are wasting. And double scores really being used this time. So we could have some changes in the scoreboard. Oh no, the time's all gone. Let's see your answers. Oh wow. Looks like we have a lot of Hymenolepis. No, Hymenolepis. We have Hymenolepis nana and Hymenolepis diminuta. So it's certainly interesting to see which specific Hymenolepis is correct. And we have Team Denki who used their insurance to answer. Team. This is certainly very interesting. And this time there's quite a range in the time. Let's see how this matches with what you guys have submitted. A huge congratulations to these five. Correct. And I would like to note that our first place team is apparently now out. If anyone would like to appeal, please raise your hand. Well, let's go see our scoreboard. In first place, we now have CU. CU really looked at Suriat and said, "See you." So congratulations to our new first place with a 45-point lead between from the second place team. There's also now a widened score point increase, or shall I say, a widened score point gap between our second and third place. This time it's now 25 points. So ULM Team 2 is going to have to work just a little bit harder. SSS Agar is now in 4th, and ULM Team 1 is now in 5th.
What I notice here actually, Pa, is that there are still teams with a double score left. So let's see in this final question if this will affect their placing.
Indeed. Best of luck to our final round.
All right, everyone, we've made it to our final keyword of second division. The final keyword is inflammation. You have 15 seconds. And your time is over. Guys, make sure to give it all for this one. On to the very last question. A 7-year-old boy presented with multiple honey-colored crusted lesions surrounded by erythema on his face, especially around the nose and mouth. Gram stain results reveal gram-positive cocci in clusters. This pathogen has evolved diverse mechanisms to evade complement systems. What is the specific virulence factor produced by this pathogen that can inhibit complement-mediated inflammation. Your last 1 minute begins. "30 seconds remaining. Act fast." And the clock has called. Time is over. Now let's review your answers for your last question. We have yet another consensus for most of the team in Division 2. So we've been through so many questions with consensus, Pa. I can tell that maybe teams in Division 2 are really synergistic for this one.
I agree, but the final answer is now out.
And the answer for your last question is ships or any of these combinations.
If any team would like to appeal our answer, judging from the shock, please feel free to raise your hand.
All right, now we shall see first how this matches with our team's answers. Unfortunately for our last question, no team got it right for this one. So if you wish to appeal, please raise your hands. All right, it seems like we're all settled. So on to the final scoreboard. And that is the final scoreboard. Oh, it seems like we had an appeal.
Hi, thank you for giving us the chance to appeal, but we understand that protein A is a virulence factor that also inhibits innate immunity, including the complement system. So I hope you will consider our answer. And apparently a lot of people answered it too, so.
For the contestants, Saibala, right? Thank you very much for requesting for an appeal. Seems like everybody does not like immunology. But we still love you all, don't worry about it. For your questions, our questions is the context of bacterial infection, right? And based on the standard textbook Advanced Cellular and Molecular Immunologies in chapter 13, page 2872311. This is the summaries. C5a is the most potent mediator of mast cell degranulations, and complement-mediated inflammations also can be inhibited by microbial products. Staphylococcus aureus synthesizes proteins called chemokine inhibitory proteins of Staphylococci, or CHIPs, which is an antagonist to the C5a and aflatoxins. So in this context, unfortunately, we are talking about Staphylococcus aureus and how this specific shifts antagonized C5a. So unfortunately, your appeal is not granted. I wish you good luck in the next round. Thank you.
All right, thank you, our professor, for the clearest clarification ever. Now, and that is officially our final scoreboard. Teams on the top two will proceed to semifinals. Congratulations to CU. And congratulations to Sirirat 1.
Them both a big round of applause.
But don't forget, everyone, there's still a glimmer of hope for the 3rd, 4th, and 5th rank. They're on their way to the resurrection stage. And that concludes our 2nd division. Congratulations and thank you. Teams may exit the stage now.
Congratulations once again. For anyone who would like to stick around during our short break, we have a 10-minute break, and the 3rd division of the quarterfinals will begin at 10:45 a.m. So during this 10 minutes, if you would like a chance to win a adorable purple elephant plushie, please stick around. Now, we like to keep things fun and energetic here in Chiang Mai. So to keep the good vibes going, we have a mini game for you to play while we wait for our next division to start. This is for everyone to join individually, not as a team. So simply scan the QR code on screen to join us. Or for fastest players who answer correctly will win a purple elephant plushie. All right, please scan as quickly as possible as we will be starting within the next probably 30 seconds. All right, guys, let's give you 10 more seconds to scan these QR codes to pay. All right. You have about 2 minutes and 30 seconds to answer both of these questions. Your time starts now. One minute left, guys. 30 seconds left. We're counting down from, say, 8 seconds. Our time is up. Let's see what the correct answers are. The correct answer for the first question, which is now question number 3, is triatomine bug. The correct answer for question number 4 is serogroup B. So let's give our computers and systems some time to load out who the winners are. And the winner for the third question is Thanat Daranyot, I apologize, from MedWU, and Suvirut from MM. So a huge congratulations to these two. And our winners for the fourth question is, and I apologize, Ni Yan Kin from Viral Vectors and Achman Rafai from Air. So I believe Viral Vectors is also playing in our third division. So let's hope you do as well in our next division as you did just now. Congratulations to these 4 people. Your group moderator will contact you to give you your Purple Elephant Cushy prize. Thank you everyone for playing. The third round of the quarterfinals will continue in 5 minutes. All right, everyone, our intermission is officially over. Let this be the start of our third division. So, teams in our third division, please come up to the stage. Please welcome NU01.
Next, we have Microbial Mavericks
And followed by Gym Boys.
and AFK.
And our MC's favorite word to read, Pseudomonas onkarokinosa.
Next, Prince of Songkhla University 1.
And the final Sirirat team of today, Sirirat 3.
UP College of Medicine 2024.
And Universitas Gajah Mada.
And last but not least, we have 3 medic mates.
All right, now that everyone is in their positions, the quarterfinals shall commence. May all teams in our third division be immune to defeat. Our first keyword is wound infection. You have 15 seconds to choose your level of confidence and choose an item to use if you wish to do so. Your time is now up. We'll be kicking things off with our first question for this division. Actually, we won't yet because why not? Just kidding. Our first question is here because in Chiang Mai we like to keep you on your toes.
All right, we're having some technical errors, so let's give us some time to fix the error. In the meanwhile, let's talk a bit. So we've come really a long way for our quarterfinals, and we already have 4 teams representatives for our quarterfinals, and we have some teams who are still waiting to be resurrected in our resurrection round.
Yes, I agree. We have had quite an interesting past 2 divisions with all various different sorts of techniques and displays of strength. So let us do a brief run through of what we MCs remember to be the most iconic moves made. And perhaps you can use them in this division to really shoot up in the scoreboard. Our first and personal favorites used by the 2 teams from Chulalongkorn University is the combination of using double score with a high confidence level. We shot them up about 3 places and into the top 2. This was used by both teams. And now our technical difficulty is over, so let me remind you what our first keyword is so you can choose the appropriate confidence level. The first keyword is wound infection, and you get 15 seconds once again. Never mind that, we will be sticking around with just the term wound infection once again. Our technical difficulty is continued.
This is just our way to keep our third division ready for our system.
Yes, we are famous for, how do I say this, creating trust issues with our, let's start, let's not, and my personal favorite, what's the intermediate host? There is no host. So a friendly reminder to please stay on your toes here in Chiang Mai and maybe use this time to talk out some strategy as to how you're going to use your items or how you're going to be playing out your confidence level, etc. So you can get some serious points boost. And remember that our top 5 will get to continue. All right, so according to our colleagues, we are now ready to continue once again. Our keyword is, as you've seen for the 3rd time, wound infection. 15 seconds.
And once again, 3rd time's a charm. We have to apologize again. We're experiencing another technical difficulty.
Actually, we are indeed on our 3rd technical difficulty. So, Pat, could you remind our participants what the rules for the quarterfinals are so they'll be ready to start when we get back?
Right, so before every question, you'll hear a keyword announcement, and at that time, you'll be given 15 seconds to decide 2 things. First, you choose your level of confidence, and second, decide whether if you want to use any items. And I don't recommend gatekeeping because we have seen so many cases with faulty for being gatekeeping. Then the question will be shown and be read by both of us. After that, we will give you 1 minute to do your best to come up with the correct answer. But remember, every second counts in this round. The faster you submit, the higher score you're able to get. So make sure that you use all seconds wisely.
Well, guys, let's use this time to perhaps slow down our heart rate after the chaos that has just occurred within the past 5 minutes from let's start to let's stop to let's start to let's stop, because I know my heart rate has certainly gone up with our first question for reals. Our first question is, a 30-year-old man developed profuse diarrhea, abdominal cramping with high fever after taking ciprofloxacin and hospitalized for 7 days. The whitish plaque over intact colonic tissue were seen on colonoscopy. The causative agent was identified as an anaerobic, gram-positive, broad spore former and produced barnyard smell in culture. What is the bacterium that caused this illness? Please give the full scientific name. Your 60 seconds has begun. Start. You now have 20 seconds left. Your time is now up. Let's see what our teams have sent in. Wow. Well, for this time, we have quite, or actually not even quite, 100% consensus with every single team answering my favorite word of all time, Castridioides diffusi. So today we are going to be seeing every single team make it or every single team break it. So here we can see that most teams answered rather quickly, with some teams taking less than 10 seconds and others taking 10-ish seconds. Not a single person has touched the 20s. Without further ado, let's see if you are all correct or all wrong. The correct answer is indeed Castridioides difficile. Congratulations to all 10 teams. Let's officially compare it, just for official reasons. But we will now get to see if time and usage of confidence level really affects the scoreboard. Let's see. In first place, we have Microbial Mavericks. And in second place, we have UP College of Medicine 2024. And
Actually,
they are both
it
at
seems
a
like we
tie.
have someone who's appealing, so let's see what they have to say.
Okay, thank you for the chance. For the answer of Pseudomonas oncaricinosa, there is Diffchiller. It's not true. It's not correct, sorry. Diffchiller. Clostridium difficile, but they answer Clostridium difficile.
Okay, thank you so much. We accept that for the sixth team, we got wrong answer because it's wrong spelling. Thank you so much, team boys. Good job. Thank you.
That was an amazing appeal from our team. So a huge congratulations for their move, although I think the Pseudomonas team might not have appreciated that. And we have another appeal from the MB team.
Well, apology for the team Siriraj 3. Clostridioides, missing an I in the species name. Thank you.
Okay, again, teamไหนนะ So again, Sirirat, number 3. Cross 3. Yes, also wrong answer. Thank you so much. Well done, guys. You got your very good eyesight.
Yes, congratulations to our teams for being very, very specific and being very particular. I'm sure that will save a lot of patients' lives. And thank you to our judges once again. Guys, here's a friendly reminder to leave all the points that your other teams may have cost you. Let's leave our beef on the stage. But without further ado, let's see how all of these changes affect our scoreboard. In first place, we still have Microbial Mavericks, followed by UP College of Medicine, though they both have the exact score of 180 points. So so does the third team. So there are actually 3 teams currently tied for first. Don't get the numbers for you. And in second place, we have both NU01 and AFK. Then followed by, I believe, 3 third place teams, which are Gym Boys and Prince of Songkla University 1. So this really shows that the third division could go to anyone. Nothing is finalized yet. So that is just amazing.
All right, and before we go to our second question, I have to sincerely apologize again on behalf of the staff for the earlier technical difficulties. But I promise our system is now vaccinated and fully working now. So let's see what's the next topic has to be.
Yes, indeed. It is a very exciting start to our third division, with everything from difficulties to a question where everybody got it right, then not everybody got it right.
And that was a really fun appeal in our first question. So on to the next one. The second keyword is inflammatory cells, 15 seconds. And you're out of time. Now it's time to see the question. H&E stained brain tissue shows a neuron surrounded by inflammatory cells. Name the intracytoplasmic eosinophilic inclusion bodies. Contestants can press the picture to zoom in. Your 1 minute start now. Thirty seconds left. And that's a wrap. Let's see what you guys have sent in. Wow, we have a real consensus for the first time, if I'm not mistaken. So all teams are saying Negri bodies.
All with the same spelling this time as well.
So, as this is a really easy one, so we shall see if they are correct. The answer is Negri bodies indeed. Congratulations, everyone. Coming up is the scoreboard. Congratulations again. So as everyone got it right now, it's the matter of time and the confidence level. And since no team has decided to use their items yet, so it's just really pure time and confidence for this one. We can see how it really matters. Every bit of second matters in this quarterfinal stage. How would you think about the teams who are in this question?
Yes, I do think that this question is a clear show of the importance of confidence level. As we can see, our first place team actually chose the highest confidence level, them all at a confidence level of 3. But let's not dwell on the past. Let's move forward onto our next keyword, our third keyword, which is fungal infection. 15 seconds is on the clock. Your 15 seconds is up. On to our question. The infected tissue was obtained from a subcutaneous nodule on the left knee of a male patient. Histological examination showed acute ankle branching septate hyphae. All mycological units. The culture grew within 3 days, presenting as a fluffy colony with diffusible purple pigment. Fusiform macroconidia and microconidia are present. What is the likely diagnosis? 60 seconds is on the clock. Begin. Seconds before the infection spreads from this tissue to you, our competitors. Time's up. All of our doctors, aka our teams, have been infected. But let's see what they sent in before they were out. It looks like there is actually quite a wide range of answers this time, ranging all the way from fusariosis to aspergillosis, all the way to exophilia. Wow, there's just quite a wide range of answers right now. So it's really anyone's game as to what could be potentially correct. What are your thoughts on this, Pat?
So earlier we had a full consensus, but now we have such a diverse set of answers. So I feel like maybe fungus isn't really a thing for our third division. We'll see who got it right.
Yes, I agree. Perhaps our teams don't really like the topic of fungus, seeing as to how two teams even decided to use their insurance in hopes that at least one of their answers will be correct. Well, this is certainly a very interesting round with a lot of diverse, hard to pronounce answers. So we MCs are certainly very excited as to see which one of you is going to get it correct.
And it's actually interesting how teams are already starting to use their items now because if I'm not mistaken, they have all been gatekeeping everything they got and now they're using them. So I feel like the game is getting much more thrilling.
I agree, and our correct answer is now ready to be unrolled. So without further ado, the correct answer is hyphomycosis or fusariosis. Congratulations to certain teams. This was a really tough one. Congratulations. So let's see which teams got the point. Congratulations to Sirirat 3 and UP College of Medicine 2024. Let's see how our scoreboard looks like now. Wow. Well, congratulations to UP College of Medicine 2024 for being in first place. They took 45 seconds to answer, but they chose a high confidence level and they got it correct. So it paid off. They went from second place to first, but hope is not lost for our microbial mavericks. Meanwhile, Sirirat 3 shot up all the way to third place. So that is certainly a really huge jump. So major congratulations to Sirirat 3 as well. Well, this really shows that anything can change in this third division.
All right, and here is our next keyword. Cyst. You have 15 seconds. And the clock has run out. It's time for the question. A 32-year-old woman presents with right upper quadrant and epigastric abdominal pain and nausea. MRI of the abdomen reveals a low-density unilocular hydatid cyst. Aspiration of the cyst yields clear and colorless fluid, and unknown organisms are seen on microscopic examination as shown in the image. 2 questions for this one. 1, what is the causative agent of this disease? Please give a full scientific name. And 2, what is the route of transmission of this disease? Your 1 minute begin. Thirty seconds remaining. And time is up. Coming up are your submissions. Wow, this is such a consensus for question number 1, I suppose. All of them are answering Echinococcus granulosus. But we have such a wide range of answer for question 2, which is asking about the root. So I wonder which one is correct. Though we do have most of the team going to fecal oral route, some of them saying eating contaminated food, some of them saying consuming raw snail. So that is a pretty different way that they have interpreted and answered the route of transmission for this
Yes.
specific pathogen.
I agree. I do feel that for the second part of this question, we see quite a different range of answers, all the way from oral to fecal oral to ingestion to eating something contaminated. But at the end of the day, they do sort of mean the same thing, which is just to eat something that is contaminated. So I think we'll really have to see that when compared to the answer, will all these various different word choices and the word usage for the second portion of this question get a point. It could essentially be the difference for a lot of teams. So we'll just have to wait and see of how wearable the correct answer can be.
And currently I'm looking at the team, even though there are 2 questions, there's one team, actually 2, who used only 10 seconds for this question. It's pretty interesting how they are so fast. So let's see if their fast fingers will reward them their points or not.
Yes, I agree. We're also in the generation of the iPad kids, so I suppose that's why we're really typing at this particular speed. But yes, I do think that I would like to, however, also note that we do have teams that took more time, such as our second place team from last round, Microbial Mavericks, who took, I believe, 40-something seconds. So it will be interesting to see how this plays out.
All right, and we are ready. In this case, the correct answer is, for number 1, it's Echinococcus granulosus. And the second, it has to be ingestion of food or water contaminated with the eggs. Now let's see who got it right or wrong. Congratulations, we have 2 teams who got it right. Well done, guys. Let's see how this will change our scoreboard. And both 2 teams. Oh, actually we have someone who's appealing.
Excuse me, judges. Thank you for the key answer of the question. The key answer is said that the root of infection is ingestion. So maybe our answer from oral route is obviously ingestion. I think maybe you can consider it as true answer. Thank you.
Okay, thank you for your asking. For this parasite, human are intermediate host, so become infected by ingesting infected egg. So because the definitive host is the dog, and in this case we ask the infection. So you have to specific the answer is infection of the eggs.
All right, thank you for the appeal and thank you our professors. So, as expected, the 2 teams who got it right are up on the scoreboard in top 2 now. It's pretty interesting how team in the rank 1 is in the lead with such high points already. And those following are in a really close call, and it's a really close fight between them. So I can feel like they are fighting for that second spot.
Yes, indeed. I believe our first place team has actually not gotten a single question wrong yet. It's very impressive. All right, now we are officially halfway through and are on to our 5th keyword, which is immunodiagnostic. You have 15 seconds. The clock has run out. Now, please quarantine your attention to our fifth question, which is a 19-year-old man presented with a rash on palm and sole for 1 week. The results from RPR and TPHA were non-reactive and reactive, respectively. Later, the RPR was repeated with the serial dilution of patient's serum, and the RPR slide was shown in the following figure. Name of the phenomenon observed on the RPR test. You can zoom in to officially see our test very closely. Your 60 seconds now starts. Half a minute left, everyone. Show your brilliance. And you've hit curfew. Time's up. Let's see what everybody sent in before they were sent to bed. All right, so from the looks of it, the most common answer seems to be prozone phenomenon, with some teams even going to answer prezone. So is it pre or is it pro? Another common answer is agglutination. So we definitely kind of have two teams in terms of what could be the correct answer, agglutination or prozone phenomenon. But without further ado, let's see what is correct. The correct answer is prozone phenomenon. Congratulations. All right, let's see which teams got the point. Okay, well, here they are. These 5 were the ones that came out on top. Now let's see how this affects our scoreboard. Officially in first place with a gigantic, ginormous, unbelievably large lead, UP College of Medicine 2024. In second place, we have the Gym Boys, and in third place, we have Sirirat 3, actually trailing behind with only 50 points. And behind Sirirat 3, we have NU01, who's only behind Sirirat with just 10 points. So we can have a shift between who's second, third, and fourth rather easily. So we'll just have to wait and see in our 4 remaining questions who will actually qualify to go directly to our semifinals.
All right, and we are on our 6th question. Let's see the keyword. Genetics. 15 seconds is on the clock. And the clock has called. It's time to see the question. What is the enzyme coding gene found as part of an insertion sequence, a bacterial mobile genetic element? Your 1 minute to answer, start. 30 seconds left. There's no time to waste. And time is over. Now let's review your answers. So we are seeing most of them going for transposon, and there is also one of them who said a pretty similar answer but was transposase. So I wonder which one is actually the correct one for this one. There are also team who decided to use items for this one. Also, the minority are saying integrase gene, restriction enzymes, and one of them going for 16S ribosome, I suppose. So I wonder which one is actually correct. Maybe this question is pretty difficult because we really see that most of them did take quite a lot of time to answer. What do you think, Pa?
I agree. This does appear to be a relatively difficult question, with even our top first place team leaving it blank.
So for this one, the answer we're looking for is transposase gene, or TNP.
If
Now,
that
let's
not
see.
many teams answered that.
Congratulations, we have only one team who got it right.
Wow, that is absolutely amazing.
Great job.
Congratulations.
So if there is any team who wish to appeal, please raise your hands now. All right, so I think everything is settled. Now coming up is the latest scoreboard. Congratulations, we have only one team who got it right. And we do see that there's also several teams who got their points deducted for choosing a high confidence level. So that's a penalty you want to take. The more risk, the more points that can be deducted.
Yes, though our one team who got it correct is now officially in 5th place. So if nothing goes south for them, they will at least be making it to the resurrection round. So a huge congratulations to that team, who will most likely be moving forward if things continue on the same path.
Right, and the next keyword is around the corner.
Yes, the keyword this time is virus. You have 15 seconds. All right, decision-making time is up. It's now question time. A 6-year-old boy has an illness which begins with fever and malaise. Later, a rash appears on his cheeks. Name the pathogen that is most likely the causative agent of his illness. All right, 60 seconds to make your diagnosis and potentially save his life. Begin. Hold on. 30 seconds. Make it count. Diagnose the boy. And time's up. Let's see what your diagnosis is. Wow. It seems that every single person has written parvovirus B19. I believe that is every single team. With an exception to their team that used their insurance writing in a second answer.
I really love the sense of humor from Microwave Mavericks. They're so brave to use their insurance just to give us a cute smiley face.
Yes, we are really showing much hospitality from our Chiang Mai University home team. That's Chiang Mai humor for you. All right, though I think that a consensus like this does mean that the time that you use to submit your answers is really going to make a difference, with some teams using only 7 seconds and 9 seconds, while others went up to 19 seconds. So this could make a really big difference, since it's probable that every single team could be getting the point.
Or it could also be the case that all teams got it wrong. Remember, that already happened. We never know.
Oh yes, that is true. Now it could instead come down to who used the lowest confidence level if every single team gets it wrong, as displayed in the final round of our second division. That is certainly another possibility. Well, I think that is something that really goes to show that the quarterfinals really keeps you on your toes. Well, I think that it's certainly been a very interesting round, and we are officially done with our 7th question, which only leaves 3 more. So, without further ado, let's see the correct answer for question number 7, so we can proceed to our last 2. It is indeed parvovirus B19. So let's see how many teams got it right. Oh, I see. We had a variation on the spelling of parvovirus. So if anyone would like to appeal, do raise your hand. If not, we will be heading to... Okay, we do have an appeal, so our colleagues will get to you.
Sorry for, I think our answer, parvovirus B19 virus, and why is it wrong? Please give me the explanation, please. Thank you.
Thank you for your challenge. According to the reference in the JAWET 28 edition, page 419, about parvovirus, page 457 and 459, the parvovirus in textbooks use only parvovirus, not parvovirus B19 virus again.
Well, that was still a good attempt at an appeal, and thank you to our professors for their comment. Now, let's go see how this affects the scoreboard. Still in first place and second place is UP College of Medicine and GYM Boys. And well, I believe everything's remained almost entirely the same. Third place, we have Sirirat 3 and NUO1 in fourth. So right now, we can see that our first place team has really widened their lead to be over 300 points, I believe. So there is still only about a 35-point difference between the Gym Boys and Sirirat 3. So they could quite easily overtake Gym Boys, and that's something that we will have to keep an eye on in our upcoming rounds.
And we can also see that most of the team are gatekeeping their double score. So we'll see if they're using it this round. Here comes the next keyword. Dermatologic infection, 15 seconds. And time is over. Let's go to the question. Name 3 fungal species that are associated with Taenia versicolor. Give full scientific names. You have 1 minute. The challenge begins. Twenty seconds remaining. And that is a wrap. Now, here are your submissions. Well, that is a really, to be honest, that is hard to read, but we can see that there is one that we have in common, which is Malassezia furfur. I believe that that is a pretty, common for the teams, as I believe everyone knows that. But it brings to the question if their second and third answers are correct, because they have to get all to get the point. So we can see that there are also teams who are going into a different species of Malassezia. There are also teams who decided to go for a different genus. So we will have to wait and see how this will be in the end.
It's also something that is worth noting that some of the answers that were given here, such as Hortia wernickeii or Malassezia furfur, were actually answers that have been given in the previous 2 divisions that were played. So I think it's something that we would likely all wonder, would the correct answer really be something that already was a correct answer in a previous division? I think that's something that we should all definitely wonder and keep in mind as well.
All right, so the verdict is in the process, but we have to see that what's interesting is that all teams are still having their items unused. So even though I see that there are some few items used in this round, there's still some that are being gate kept. So maybe if I can feel, I think this one is a pretty difficult question. So maybe it would be more strategic for teams who have been gatekeeping and not used for this question.
Though I do think using a shield or an insurance in this particular round might be worth it, seeing as to how you have to get a total of 3 answers correct to actually get the point. So it might be worthwhile to use your insurance or use your shield here today. It's also worth noting that in a round like this one, where it's probable that a lot of teams will be getting something wrong, that the confidence level that you chose is something that's really important, as it will affect how many points you will lose once you get it wrong.
Right, and as we're waiting for the judges, please let me remind you that we are almost at our last question. There are only 2 questions left, so make sure to plan your best, think of the best strategy, and decide how you will use your items wisely. Now, the valid answers for this question is Malassezia genus and any of these species are acceptable. Now let's see how our teams are doing. Congratulations to Jim Boy for being the only team who got it right. If there are any appeals, please raise your hand now. All right, it seems like everything is settled, so we shall see the scoreboard. It's Jimboy coming up in the second place already. Congratulations, it was a really wise choice, and what a brilliance they have shown in this question. And they even shows the confidence level of 3. That was a really bold, yet one of the best move ever.
Yes, by doing that, Jimboy has actually managed to close down their gap between Jimboys and UP College of Medicine. In the past, UP College of Medicine's score was all the way up into the thousands, and they almost seemed undefeatable. But now, with what's going on, there's only a gap of 120 points between there's only a gap of 120 points between our first and second place team. And this is something that can easily be closed with using double score and a high confidence level. So let's continue the game and see if Jimboy will overtake UPM. All right, so our second to last keyword is parasite. 15 seconds on the clock. The time has run out. The question you'll be getting is, an 8-year-old boy presents with a 2-month history of chronic rash on both hands and intense itchiness over much of his bodies. KOH preparation reveals an unknown organism as shown in the image. What is the full scientific name of this organism? Participants can zoom in to fully see the organism. Best of luck to all. Your countdown begins from 60 seconds. "30 seconds left, time's a wasting, and all your double scores are a using. It is our second to last round after all. And the time's now all gone. Let's see your answers. Wow, it looks like every single team seems to have had the same idea, which is to answer Sarcoptes scabuli. But is this correct? We shall have to see. What are your thoughts on this, Pat?
I feel like we're now back at the sake of spelling difference here. So I can tell that all of the teams are thinking of the same answer here, which is Sarcoptes scabii, but it depends if they are correct on the spelling. They really need to be precise with this one because spellings really matter.
Yes, I do see that some teams have more eyes than the others, and there's one that's missing an eye, etc. So we will see if our colleagues will be catching that early on, or if there will be another episode of let's appeal another team's spelling error. Certainly very interesting. And it could be a game changer for quite a few teams, especially with the score difference between our first and second team becoming quite small. But without further ado, the show must go on. And let's see our correct answer, which is Sarcoptes scabuli. Let's see how this compares to what our participants sent in. Wow, from the looks of it, we have a total of 8 teams who got it correct and 2 teams who got it wrong on account of spelling error. So let's see how this affects our scoreboard. From the looks of it, it seems that the UP College of Medicine and Gym Boys have broken 1,000 points, with UP College of Medicine using a confidence level of 3 and likely also using their double score. So now they have a nearly 400-point lead on the second place team and seem to be locked in for first. And there is apparently about a 60-point difference between our second and third team, which is something that can be overtook with a high confidence level and if the other team gets it wrong. So the essential play for who's going to be the other team to join UPM in the semifinals is still up for grabs.
All right, ladies and gentlemen, we've made it to our last keyword and last question. The final keyword is molecular immunology. 15 seconds. And time is over. Now let's move on to the question. A 25-year-old female presented to the emergency department with a sudden fever, nausea, vomiting, and diffuse sunburn-like rash on her palms and soles. She mentioned using a tampon for the first time during her current menstrual cycle. A report on her physical examination is as follows. Blood cultures were taken, and intravenous fluids were started for resuscitation. Which region of T-cell receptor specifically binds to this microbial protein? You have 1 minute, begin. Last 30 seconds. And time is over. Now let's review your answers. We have a consensus of the team, about 4 to 5 teams saying variable beta region. Some of them are going for MHC classes 1 and 2. We have a really broad range of answers for the other team who didn't answer these, which are alpha region, CD4 co-receptor. There is also a team who chose to use their insurance saying desmosine and CD4 T cells. So I wonder which actually is the answer that we're looking for. Which specific region of T cell receptor are we really looking for this question? How would you think about this last question? Will it be a good ending?
I do think it will be one of those endings where some teams are going to get it correct and then some teams are going to get it wrong, because
now
we have
let's see
quite
if
a few.
it is a good ending or not. The answer is Vero beta domain or region. Now let's see which team got it right. Congratulations, teams. Well done. Now, the scoreboard that is about to appear is the final scoreboard.
Wow. Well, we now have our official scoreboard for Division 3. Congratulations to UP College of Medicine 2024, and congratulations to Gym Boys for placing first and second. Our colleagues, the Powerpuff Girls, cannot wait to meet you at the semifinals. 4 teams, Sibirat 3, Microbial Mavericks, and AFK. Congratulations regardless, because it isn't over for you yet. You guys have made it to the resurrection round, where you can fight it out with some other teams for another chance to make it to the semifinals. Thank you all for being a part of the quarterfinals. You may now exit the stage. And now, our quarterfinals, all 3 divisions, have officially concluded. We now have our 6 teams who will proceed to the semi-final stage. But don't forget, we still have our resurrection round tomorrow morning for teams who placed 3rd to 5th. Before we officially bid farewell, on behalf of Pat and I, as your beloved masters of ceremony, we hope that all of our competing teams and audience had fun and learned something new today. We hope our humor and emceeing spread joy, and not germs, to every one of you. More contagious excitement awaits you this afternoon and at tomorrow's stage. But right now, we would like for all teams to please follow their group moderator to lunch. Thank you for today, and see you guys next time. Once again, teams, please follow your group moderator to lunch.